Thank you very much. I call on Jeremy Balfour to be followed by Mark Griffin. Jeremy Balfour.
Thank you, Presiding Officer. I think, as the Minister has said, this has definitely been the hardest part of the bill for all of us to get right. It has been a journey that I think we have all been on as a committee and as a government, and I think we have ended up in the right place for those who are most vulnerable in our society. The reason that I introduced the 2-year stage at stage 2 of the bill was that from my previous experience sitting on tribunals, there were sadly cases that came before the tribunal where someone who had made an application was terminally ill but didn't live, but was going to live beyond the 6-month period, but sadly died quite quickly after that period, did not get into the special rules, and thus did not receive the money which could have helped them provide better services towards the end of their life. And from my perspective, the 6-month rule was simply too short a period of time. And so I do welcome the government's discussion with different groups and with other MSPs on this. And I think to take away the time limit completely actually is the right way forward, because whatever time you come up with, whether it's 6 months, 1 year, 2 year, 5 year, it is clearly going to be artificial, and clearly some people will get in and some people will not. And I think also, and having been lobbied heavily by my older brother, it is very difficult for GPs sitting in their room to say with any definition or clarity, sadly, you might live for less than 6 months or 2 years. And as well as giving that diagnosis, they also have to deal with that patient with so many other things that are going on in their life. And clearly it is important that people get the right benefit, but it's only one of the things that a GP or a consultant or a nurse has to deal with the individual. So I think we have made progress. I think we're on the right course. I think the guidance, again, will be very important, and I welcome the Minister's assurances that she will work with the medical officers, with the medical profession, but also with those working in the sector from the third sector as well. Can I pay particular credit to Marie Curie and MND for the work that they have done around this and for the helpful information that they have given. Clearly, no one wants to make this a party political issue. This is what, surely, as a parliament, we come together to do the best that we can. And I think, can I pay respect to the Minister for doing that, for trying to take all of us with her, but most importantly, for helping those who have been given a diagnosis that none of us would ever want. Thank you very much.
Can I call on Mark Griffin to be followed by Alison Johnson?
Thank you, Presiding Officer. We will support all of the amendments that are going to be pressed in this group, and particularly thank the Minister for bringing forward the amendment on special rules and taking forward the policy from the amendment that I had lodged at stage 2. And while we were pleased with the changes made at stage 2 to increase the definition of terminal illness to be used to 2 years, the removal of all time limits is a victory for campaigners and those who are terminally ill. Ultimately, the change is very welcome. That change to essentially move to base a terminal award on clinical discretion and the needs of the terminally ill was not expected just a matter of months ago. MND and Marie Curie, who have representatives in the gallery today, should be particularly proud of the work that they have done to secure this change. But I do want to sound a word of caution that while this change in policy is welcome, and that we do have to learn lessons as to how those changes came about. And the lesson we need to learn is that process cannot and should not be a template for how ministers are going to set up the new system. We're expecting swathes of regulation which will include the intricate policy design of 9 forms of assistance. And for the campaigners and for the people for whom this social security system is meant to be an investment, they need the assurances that more detail and policy will be done out in the open, well in advance of decision-making in the months ahead. Thank you, Presiding Officer.
Thank you. I call Alison Johnson to be followed by Alex Cole-Hamilton. Alison Johnson.
Thank you, Presiding Officer. I think I entirely agree this is one of the most sensitive and challenging issues we've had to discuss, certainly during this bill process, if not in this Parliament. And I am very pleased with the outcome. I welcome the improvements that have been made through the Minister's amendment, and we will be supporting all amendments in this group. Now, there were many MSPs on the committee and organisations involved with the bill, and they've worked hard to find a way to resolve this complex issue. And the Scottish Greens are very pleased that this new amendment clearly places these sensitive, difficult decisions in the hands of clinical experts. In a previous letter to the Scottish Government, the Chief Medical Officer stressed that decisions about when to fast-track people's benefits should focus on the health of the individual, not the medical condition or the timescale. So I think removing that restriction on timescale and allowing medical practitioners to exercise their expert judgment in its fullest capacity is the best way forward for both patients and clinicians. So we very much welcome this change, and I too would like to also express my thanks in particular to Marie Curie and MND, whose input in this process has been invaluable. Thank you.
Thank you. I call on Alex Cole-Hamilton to be followed by George Adam.
Thank you, Presiding Officer. I'm sure every single member in this chamber would agree that the measure of a civilised society is the compassion with which it treats those given that hardest of news, whether that's in a doctor's surgery or in a hospital. I want to thank the government on this. I think they have worked the hardest to build consensus, and I know that the work was going on late into the weekend over the wording around this consensus amendment, so I absolutely rise in support of 148 and 113. I think I can understand the drivers behind Amendment 111, but we would have stuck with the original Stage 2 iteration of this because we felt it just simply didn't extend enough support. It also put doctors in a very invidious position of having to decide not only at that time of that heartbreaking conversation, but whether that meant that somebody got an award or didn't. Policy around end of life is always very, very sensitive, and we owe it to all those people faced with that devastating news that we will strip out the party politics of it. So it's right that we put this in the trust of our clinicians, who I know I and everybody in this chamber trusts implicitly under the guidance of our CMO. And I'd just like to finish by adding my voice in thanks to MND and Marie Curie, who spelt out in very important, personal and visceral detail just what this means to so many people in our country. So I thank the government again for the distance they have travelled on this.
And George Adam.
Sir, I'm only too aware, I've been on the committee and for other reasons, how complex and sensitive and difficult this issue has been. And I commend the Minister and other colleagues for the fact that we've been able to come to where we are today as well, because it's a difficult conversation that everyone's had to have during this whole debate on terminal illness. And most members will be aware my wife Stacey has MS, and along with 11,000 others, they're celebrating MS Awareness Week. Now, that's a progressive disease, but you may think, the way she's been bullying most of the MSPs today, that she's quite healthy and carrying on with things, but it's MS itself. We could be in a position in that time eventually where this could affect us. And that's one of the things that I look at all the time when I'm looking at issues like this as well. And I also look at the fact that the constituent I spoke to last week in Paisley, who actually said to me when we're having a discussion about her own individual circumstances and this debate and these amendments in particular, and her argument was the fact that she was looking to have no timescale because she thought that there shouldn't be, the timescale should be up to the clinicians to decide how we go forward. And just in closing, Presiding Officer, I think we've got ourselves to the right place, because it's not for us as politicians to decide an arbitrary figure and time. It's up to the clinicians and giving them the scope and ability to actually be able to make sure. And we have to take into account as well, if someone gets, if we used an arbitrary figure like 2 years, 3 years or whatever, you know, an individual will make life-changing decisions when they get that actual kind of terminal illness diagnosis as well. So your average clinician is not going to want to put someone in that position. So I think we've got to a very good place. I think we've got to a place here now where we've got the public on our side. And just in finishing, Presiding Officer, I think this, in the real world, in people's lives, this is what we've been dealing with in this issue. And I think that alone has shown that this Parliament can come to a level of maturity and deal with an issue like this.
Thank you very much. And I call on the Minister to wind up in this group.
Thank you, Presiding Officer. I will be brief, but there are a couple of things I do want to say. I genuinely appreciate the collective effort and the input from medical professionals, from stakeholders and from my fellow MSPs to find the best approach to terminal illness for our new social security system in Scotland. In all our discussions, people have always given careful consideration to the issues and the complexities involved. I know that we can all agree that the central principle in our approach should be to ensure that those who have to confront all the personal and psychological issues that come with a terminal diagnosis are provided with the support they need when they need it. Medical practitioners will play a vital role in implementing this important change, and I'm grateful to the medical professionals for providing their views and for their offer of support in developing the guidance to deliver this new position. I'm also grateful to my fellow MSPs for their very considered approach to this complex issue and for continuing to discuss this with me. It is clear that we all agree on the best way forward, and I welcome the cross-party support. I believe we've arrived at the right solution to ensure that people who are already in extremely difficult circumstances are able to access the maximum level of financial support they are entitled to, quickly and with the dignity and the respect that they deserve.